Ang COVID-19 ay panibagong kontrabida sa buhay nating mga Pilipino.
Habang unti-unti tayong bumabangon muli, patuloy ang laban natin dito.
Para matalo natin ang kontrabida, we can be the solution.
Kaya mong maging bida, basta susundin ito.
B. Bawal walang mask.
I. Sanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Dumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
Be the solution sa COVID-19.
Of all the tough decisions you have to make today, your family's health doesn't have to be one of them. Not when you have the choice to go organic and live full, natural, and holistic lives. So start your day right. Load up on antioxidants. Choose only organic superfoods. And keep the momentum going. We're making it easy for you. Live organic, choose organic. It's easier than you think. Mahalagang paalala, ang organic acai premium blended freeze-dried capsule ay hindi gamot at hindi dapat gamitin panggamot sa anumang uri ng sakit.
Organic acai has very high levels of antioxidants and essential nutrients that help keep your immune system strong. Organic acai premium blend and freeze-dried capsules daily to help increase your resistance against harmful viruses. Keep yourself and your family healthy and protected with Organic.
Mahalagang paalala, ang organic acai premium blended freeze-dried capsule ay hindi gamot at hindi dapat gamitin panggamot sa anumang uri ng sakit.
Probably the unhealthiest
Previously
type.
on Wellness
I love bacon, hot dogs.
We fight this pandemic because when we talk about this plant-based, when we talk about diet, when we talk vegetarian, they can still eat, some of these eggs or dairy products. But when it comes to vegan,
Wellness Wednesdays with Organic. We care because you matter.
In support to DOH Bida Solution campaign.
Hi, welcome to Wellness Wednesdays. Happy Hump Day to everyone. I hope you're all taking care and staying safe. Before we start, I just want to invite everyone to like and share this video. We also have a Facebook game. Don't forget to comment below. If you had watched our Wellness Wednesday last week, we have the same Facebook game. Now we invite you to share your organic stories and get the chance to be featured on our Wellness Wednesdays. Last week, we had some amazing stories. I can't wait to hear more. So our topic for today, nasopharyngeal cancer. And I hope I pronounced that right because I totally practiced before this live stream on how to pronounce nasopharyngeal cancer. Now, why those are having such a hard time pronouncing this? That's because it's not that common of a cancer. In fact, in some areas, less than one out of 100,000 people get nasopharyngeal cancer, but not necessarily here in the Philippines or in Southeast Asia. In Southeast Asia, it's actually a lot more common than we think. So lots of things to be looking out for. And for that, of course, we have to talk to our expert. We have here Dr. Sunny Valoria, integrative medicine specialist, who is here to explain to us more about nasopharyngeal cancer and how we can be aware of it. Now, Doc Sunny, welcome.
Hello, Lisa. Good afternoon to everyone. So I'm just going to correct. If it is medyo Americanized, you call it nasopharyngeal. Pero if it is Filipinized, it can be nasopharyngeal. So you have to choose what you like. No? Anyway, you were telling about the statistic of nasopharyngeal. They are saying it's about 1 out of 100,000. That is statistics came from America. But locally, we don't have, no? Pero surprisingly, it is more common among the race Southeast Asians, no? And even the Inuit Alaskan. And I can see why so, no? Because we are so fond of what you call tuyo. Do you know what tuyo is? Daing, danggit, cured fish and meat products. Even in Alaska, that's how they do it. They also put their products, right? No? And all yung processed food, particularly, that can contribute more the frequency of having the nasopharyngeal cancer. Anyway, what is nasopharyngeal cancer? It's actually a form of cancer or abnormal growth of tumor, particularly at the back of your nose or at the back of your mouth, no? And it's a wide area. It could be what you can call, it's a connection. There is a connection between your nose, between your mouth, and between your ears. So there are so many manifestations which can be related to those organs as well.
Okay. So, Doc, thanks for explaining nasopharyngeal cancer or nasopharyngeal cancer. But so, what are the causes of it? So, if that's what it is, tell me what causes nasopharyngeal cancer?
We mentioned all about the food, not particularly. Second, there is also the risk about smoking and alcohol intake, no? And then tobacco and alcohol, and then Epstein-Barr virus. What is Epstein-Barr virus? No, you have to clarify. It's an ordinary type of viral infection, which is somewhat a relative or cousin of herpes virus. But this happens in the internal organs. Now, the thing about it, it can go with or without. It's only in extreme cases that it can develop or cause the nasopharyngeal virus. But even the Epstein virus in ordinary condition, it can be in our mouth. But unknowingly, we don't know that we don't have symptoms because we have a good immune system. However, if there are some other conditions which can contribute like that, just like say diet rich in salt, with fish and meat, tobacco and alcohol, even exposure to chemicals, formaldehyde. What is formaldehyde? It is formal. And then in construction works, those are risk factors also, which can contribute to having the nasal. Pero locally, I would say there's a big correlation also, particularly with smoking tobacco.
Oh, okay. Doc, I just want to insert here. How can I get EBV? Like, is it transmitted respiratory? Is it saliva, blood, STD? Ba?
It's not in the blood. It's actually the saliva. No, you cannot tell exactly. It can be coming from the food. It can be coming from the hands, and particularly, or it can be saliva from other person. That could also be transmission.
Okay, and then yung EBV, you said it's rare that it actually escalates into nasopharyngeal cancer, no? So, what's the likelihood of that happening, and what's the likelihood of recovery from EBV?
EBV, you can recover it without proper medication. Particularly, but it is a form of virus, no? So that's why I tried to tell earlier, kung malakas ang resistensya ng katawan, you won't feel anything that you have an EBV. It's only when you test saliva test, no? Pero let's say mahina ang resistensya ng katawan mo, and there are other factors like I do a lot of smoking, and then the type of work I'm doing, and I'm so fond of the type of food now which can cause the cancer, the more than a higher chance that EBV can be converted into cancer.
Okay, thank you, Doc. And then yung second point ba, your diet rich in salt-cured fish, tsaka salt-cured meats.
Yeah.
Could you, what kind of food is this? I'm assuming mga bacon, no?
Yes.
Mga processed meat, hot dogs.
Consider as, kasi ito yung mga thing here, yung what you call delicatessen. What do you mean by delicatessen? Bacon, salami, and then a hot dog, and then so many that has undergone the process of curing now, and even that there was a mention about the Inuit. I saw on TV what they do is they preserve their fish in Alaska, no? They preserve their fish particularly with lots of salt and then cured by heat particularly. And then locally we have just like your tocino, longganisa, tapa. Those are cured type of foods, no?
Right.
And then when you go to Cebu, danggit,
yes,
danggit is also cured. You know?
I was just gonna ask.
Yeah, and then tuyo.
So tuyo is also a consideration there.
Yeah.
Diba, Okay.
That's a salt cured fish also.
Okay. Do you know why, Doc, bakit salt cured fish and meats? What's the reason it can lead to nasopharyngeal cancer?
It's the process. So for example, yung smoke itself, particularly kung ano ginamit nilang medium, no? For example, do you know that yung charred part ng barbecue, fatty part ng barbecue can cause also colon cancer?
Yes.
So
Yes,
it's
I've
the
heard.
process that you do. Yeah, and not even the process even the fumes sometimes, no? Just like you sinabi kanina, formaldehyde, it can be you don't drink formaldehyde, but rather the fumes itself, no? Or formalin can also cause that.
Right.
So it can
Okay.
be the process itself or the fumes itself can contribute to that.
Okay. Thank you, Doc. And then, is this risk bar the same for everyone, or are there some people who are more likely to get it than others?
Well, it depends, no? Statistically, it's more common among male.
Bakit
It's
male?
because maybe it's because more males are smoking as compared to female. Pero
Oh.
ngayon, marami na rin female who are smoking, no? And then if there's a family history of somebody who had nasopharyngeal cancer in the family, it can be certain genes linked to cancer development. And then have come in contact with Epstein-Barr virus. No? Again, Epstein-Barr virus can be taken from the saliva. No? So it can be, let's say, it could also be mouth-to-mouth transmission of TBV. That can also happen because it's all part of the family of herpes. Herpes, as we know, is in main case herpes is something like STD.
Right. Okay. So usually these are the ones who are of highest risk, no, for nasopharyngeal cancer. So mga viewers natin, if you are a male or you are having diets rich in salt-cured fish or meats, and then you're smoking, we'd like to invite you to consider watching this and sharing it with your friends. Baka someone can learn something from this. Because while it's not common, it's still it's still a reality, especially here in Southeast Asia. So, Doc, if for example, I know I'm one of the people at risk, how do I know that I might have the symptoms of nasopharyngeal cancer? Anong bang symptoms ba?
The symptoms particularly depends on the location, no? Just when you say lump, the neck, or kulani, ibig sabihin, the nasopharyngeal cancer has already moved or has already affected the lymphatic system, no? That's why kulani is like a bulge, particularly on the neck area, and it can be a symptom problem with the lungs, or it can be the naso or head area, no? Then blurry or double vision. How does it happen? If it affects particularly the nerve, which goes to the eyes, kasi nasopharyngeal again is part of the back of your nose. Maraming organ na affected with that. Dumadaan dyan. Chronic ear infection. The otitis media, which cannot be treated, have been treated for so long with the antibiotics, but it won't go away, but rather there should be already much investigation being done with that. Face of pain or numbness, because it is an inflammation. That's why it happens. So, headache, again affecting the nerve. Hearing loss, ringing in the ear because of feeling there is a stuffiness, no? That's why it happens. And fullness in the ear, difficulty of opening of the mouth, nose bleeding. This is very common, and then stuffy nose. Those are the common that you can find. And even sore throat, no? Which particularly sore throat, again, if it is the type of cannot be treated, it's always there. It won't go away.
Okay.
It can be a combination of any of them.
Doc, for the lump in the neck, where would you usually find it? Like here on the side or the front, or saan ba?
Usually, it's at the base of the ears.
Here where the lymph nodes are.
Yeah. Yes, because usually the lymph drain on that area.
Right.
Basically.
Okay. So,
And
Doc,
it
I
can be
noticed.
more than one, It can,
Okay.
yeah.
Sorry. Go
And
ahead.
the
It
bigger
can be
it
more
is,
than one.
yeah. Yeah, and then the bigger it is, not good. And the stonier, what I mean stonier, the harder it is, not good. And chances are it can be of the cancerous type.
I see. So, Doc, I noticed that a lot of the symptoms here, they're very common talaga, like sore throat,
Yes, yes.
headache. So when do you know that you should go get a checkup for nasopharyngeal cancer? Because most of these, like, for example, if I feel fullness of the ear, I would be thinking maybe I have a cold lung kasi, no? Like, oh, it's okay.
Well, particularly, I would say if that's already recurrent, despite the medication, despite the taking of the anti-inflammatory and antibiotics, and after 1 week or 2 weeks, it's again back, no? Particularly if the combination of any of those three or four, no? And then
Oh,
you've been
3 or 4.
suffering for so long. So it should be somehow seen by an otolaryngologist. That's the first person, the specialist, who has to see that sisilating yun. They have to check on at the back. Kasi ordinarily, you cannot, ourselves, you cannot. They have a special machine to use now, so you can see the back of the nose, no? Pinapasok.
So, okay, just to reiterate to our viewers, if you think you have these symptoms, 3 or 4, and are recurring, you have to seek what kind of doctor again? What kind of specialist?
Otolaryngology. Otolaryngologist is eye, ear, and nose specialist.
I see, I see. All right, thank you, Doc.
Yes.
And then for the symptoms, how long na reoccurring, how many months or weeks or whatever does it have to be now? Okay, this is something serious. I have to go get this checked up. How long usually?
Well, it depends. Actually, the problem with the Filipinos, they won't consult unless they cannot anymore bear the pain. But if you're going to ask me, no, why is my sinusitis, then it can be a form of sinusitis also, it's recurrent despite the medication. It's been here for 3 months. I have to see an otolaryngologist for the treatment. Particularly, as you can see, if you review the symptoms, there are some related to the ears, no? Because there is congestion in the ears. So it depends on the patient, and particularly how many of those signs does the patient have. Like if you have those at least 3 to 4 types of symptoms, I would go rather directly to the specialist within this. It has to be addressed properly. And the thing, because I have seen some patients now that they have buccal or yung sinabi natin kaninang mass already on the neck, and then that's the only time they go to the otolaryngologist or cancer specialist, and it's already late stage 3 and 4. Once you have, because the mass has already traveled into the lymphatics, so that's bad. The earlier it is, let's say, diagnosed or evaluated or found, mas maganda ang prognosis ng pasyente.
Right. So, Doc, when you go to the ENT, no? How would they be able to diagnose you?
They can use the MRI, the CT scan, or even X-ray, no? And of course, they have the otolaryngology speculum. They have to see the back of the. They can insert a tube on the nose, or it can be also particularly on the mouth, just to see the back of the nose, nasal area.
Right. Okay. And Doc, I see here my CBC, no? So in the, for example, CBC, because I know a lot of us, we take our CBCs more often than we do MRIs or ultrasounds of the neck. So if I see my CBC, what am I looking for? Am I looking for
any form
lower
of infection? Any form of infection, or even Epstein-Barr virus, which can be tested with the saliva. That could also be. But the most specific, it's either the CT scan or MRI. That's the most specific. And of course, the best is actually if a biopsy will be taken. That's the
Okay.
best.
Okay. Okay. Thank you, Doc. And so, with that, since we're midway through our Wellness Wednesday, I'd like to cut to commercial break. But before that, to our viewers tuning in right now, thank you so much for watching. Please like and share our Wellness Wednesday. Don't forget to also participate in the comments below in our Facebook game. Share your organic story for a chance to be featured here on our Wellness Wednesdays, as well as win an organic gift pack. Now, thank you.
Patuloy pa rin ang laban natin sa COVID-19. And together, we can beat the solusyon.
B. Bawal walang mask.
I. Isanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Dumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
Be the solusyon sa COVID-19!
Wellness Wednesdays with Organic. We care because you matter.
Hi, everyone. Welcome back to our Wellness Wednesdays. For those tuning in, please don't forget to like and share this video to spread the information on nasopharyngeal cancer. And then also for those who haven't participated yet in our game, please don't forget to comment below, share your organic story to get a chance to participate in our Wellness Wednesdays, and as well as get a free organic gift pack. Now, since we're back from commercial break, I noticed we have a lot of comments here, and I just want to address some of those. So, hello, Eduardo Camatoy. Hello, Dita Emperador. Ditas Emperador Tolentino, Alex Villamor, Lolita Asterero, Gabuat, Tokero, and yeah, we have so many comments over here. But there's so many of them that we have to run through our program. So next up, we have someone here who's actually able to talk about nasopharyngeal cancer from experience. So if we were to welcome Richard Diaz. Richard Diaz here is a survivor of, I believe it is stage 3 nasopharyngeal cancer. Welcome, Richard.
Hi po. Good afternoon
Hi.
po. Doc, good afternoon po. Ma'am Luisa, good afternoon.
Hi, Richard. Kumusta?
Okay naman po.
Okay, Richard. So, how are you in this pandemic? Are you taking care, staying safe? Okay
Yes po.
naman?
Okay naman
Yeah.
po.
Thank you for participating. So, I just wanted to ask, can you share your story about nasopharyngeal cancer? When were you diagnosed?
Na-diagnose po ako ng June 2014
Mm-hmm.
ng nasopharyngeal cancer.
Right. And then, ano yung symptoms mo?
Bago po ako na-diagnose, nagkaroon po ako, ma'am, ng bukol dito sa left side ng aking neck.
Gano'ng kalaki?
3 centimeter.
Oh.
3 centimeter. Na-diagnose po ako. Tapos, nung pumunta po ako sa ENT, actually, nung una, akala ko, hindi ko naman po alam na merong klaseng cancer ang nasopharynx eh.
Mm-hmm.
Nung pumunta po ako ng ENT, pina-CT scan po ako. Ang bukol ko po dito sa left ay 7. Ang bukol ko po dito sa right ay 4 po. Tapos yung likod ng aking nasopharynx, yung likod ng ilong ko, medyo nagsasarado na po yung nasa kanan po. Medyo nagsasarado na po. Okay, sarado rin talaga. Tapos ang symptoms, nakaramdam po ako noon ng lagi pong nagdudugo yung ilong ko, nosebleed po. Kala ko po dala lang po ng init ng panahon, ganun po. Yun. Laging nakakaroon po ako ng fresh whole blood na plema. Yun po. Kaya pinasitiskan po ako ni Doc. Tapos po, doon po na-diagnose na cancer na po pala yung mga nararamdaman ko po. Stage 3.
Stage 3. So, Richard, how long were you experiencing those symptoms? Na you can't breathe and I lump and then ang mga nosebleeds?
Siguro po, ma'am, mga 6 months din pong tiniis ko eh. Kala ko ordinary lang eh. Yung pala, delikado pala yun eh. Hindi ko po alam na. Tsaka, actually, kung siguro, iba naman tatanong natin, hindi naman nila akalain merong cancer sa ating nasopharynx eh. Kasi bibihira tayo makarinig po ng ganun. Yun po.
I see. And then, Richard, so what was your, if I may ask, what was your lifestyle leading up to your cancer?
Opo. Ma'am, mahilig po kasi ako sa processed food. Yun po ang totoo. Yung mga tosino, longganisa, hotdog, yan, mahilig po ako dyan. Lahat po ng processed food. Tuyo, lahat. Kasi masarap eh. Yun po ang aking lifestyle nung bago po ako nagkaroon ng cancer. Talagang po. Tapos, ang isa pa po, exposed po kasi ako sa meron po kaming tindahan. Exposed din po ako sa second-hand smoke. Although hindi ako nag-i-smoke, hindi ako nagiinom. Yun nga, kaya nga tanong ko nga kay Doc, cancer, sabi ko, hindi ako nagiinom, hindi ako naninigarilyo. Sabi ni Doc, ang cause ng nasopharyngeal cancer, yung case mo, processed food. Processed food ang pinaka-main cause niyan. Tsaka, may cause din yan ng mostly on Asian countries eh. Like Chinese, meron akong konting blood ng
Chinese.
Chinese, opo.
I see.
Yun. Kaya nung una hindi ko tanggap hindi ko tanggap cancer Sabi ko cancer, hindi ako naninigarilyo, hindi ako nagiinom, cancer. Nung sabi ni Doc na ang kaso pa ng nasopharyngeal cancer galing sa processed food, sabi ko, sige Doc, tanggap ko na yung sakit ko. Kasi kasalanan ko rin
Right. Okay, and it's very very difficult news to process, I'm sure, upon hearing, because it's hard to believe na, you know, you're living medyo okay na, no alcohol, no smoking, and then all of a sudden, my stage 3 cancer.
Opo.
Yeah, so Richard, yeah, were you very stressed ba in your life? Was it a very did you experience a lot of that as well?
Meron din po. Kung sa stress, meron din po. Meron din. Yung nga lang, talagang dinadaan ko na lang po sa kain Kaya yun.
So it's really ang pagkain.
Opo. Masarap kasi ang mga processed food Hindi ko na alam na yan pala, sisingilin din pala ako.
Yeah, I understand.
Kain ko Opo.
Ako din, I love processed foods. That was my problem in the last Wellness Wednesday. And then, okay, so Richard, can you tell us more about your treatment? What it was like to what treatments you had and what that experience was like?
Opo, ma'am, nag-undergo po ako ng 35 session ng radiation therapy and 6 session po ng chemotherapy.
Wow.
Opo. Yun po.
Okay, and did you find, so I remember when we were talking a bit before this live stream, we were introducing ourselves. You were saying that the experience, the feeling that you can't really taste anymore, no?
Opo. Paano pa?
You can't really taste na anymore, no? Because of your cancer, or was it because of the treatment?
Ma'am, nung ako'y nagpa-radiation, sabay pong ginawa yung radiation therapy, tsaka po yung chemotherapy. Kaya...
sabay.
Opo, sabay po yun. Yung po ang treatment ng nasopharyngeal po Kaya, actually, yung unang session mo ng radiation therapy, may kasamang chemo yun. Tapos, nung sa ika-18, doon sa ikagitna, may kasama rin pong chemo yun. Tapos yung katapusan, doon sa ika-35 na radiation nyo po, may kasama rin pong chemo yun. Kaya halos talagang yung immune system ko, talagang bagsak po ang immune system ko. Halos doon sa doon sa ika-5 chemo ko, ayaw na po akong i-chemo nga ni Doc dahil bagsak na nga yung immune system ko. Ang white blood cell ko talagang laglag na Malaki na po ang nawawala sa katawan ko. Yun po. Pero...
Yeah, I can imagine.
Doon sa ika-6 na, doon sa ika-6 na, mag-a-6 na session po ako ng chemotherapy, nakita ko po yung ma'am yung asahi berry sa, Salamat Doc. Nakita ko po siya.
Okay.
Yun po, sabi ko, actually, do or die na kasi malaki na, laglag na yung immune system ko, talagang ayaw na akong i-chemo ni Doc, paano ko tatapusin yung Kaya, tinaray ko po siya, ma'am, bumili po ako ng acai berry, at yun po ang ininom ko. Awa naman ng Diyos, doon sa ika-6 na session po ng aking chemotherapy, okay naman po.
Okay naman.
Tumaas naman po ang immune system ko po doon. Kaya po ako na-chemo pa ng pang-6.
Wow. So, are you still taking acai? Are you still taking? Oh, you are. How often do you take it right now?
Everyday po, nagtitake po ako ng early in the morning pagkagising po.
Oh.
Nainom po ako ng 2 shot po ng 2 jiggles po ng acai berry po.
Right. And then how about the time you had cancer? Did you take it during your treatments?
Nung una po, ma'am, hindi po ako pinayagan ng doktor na uminom ng food supplement habang kinekemo po ako na radiation. Nung hindi po ako uminom ng food supplement, ma'am, wala na po akong ano eh. Dati po akong 132 kilo. Nung ako po natapos ng treatment ko, 82 na lang po ako. Talagang halos wala na akong immune system, wala na akong wala na akong panlaban sa sakit ko eh. Kaya nung ika-6 na cycle po ng aking chemotherapy, hindi ko na pinaalam sa doktor ko na uminom ako ng acai berry.
Right.
Kaya nakaraos naman po ako. Kasi wala na eh, bagsak na yung immune system ko eh, wala na eh. Talagang Opo.
Doc Veloria, do you have any comments regarding taking food supplements with treatment and acai berry with treatment?
Well, for the case of him, actually it really helped kasi ang problem with him is bumagsak ang immune system because when you're having simultaneously chemotherapy and radiotherapy, it also attacks your immune system, the good cells of your body. Kaya ganun nangyari sa kanya, no? Kaya when you say wagsak ang immune system niya, nanghihina siya, bumaba ang ang platelet and so forth and drug niya. Kaya ngayon, ano ba ang function ng ating acai berry? To boost the immune system in the first place and to provide other nutrients that his body really needs. So it helps. Just imagine, no? On the 6 ay ayaw na gawin kasi mahina na nga ang bagsak ang platelet niya, no? Then nag-start siya ng pag-take ng acai berry, nag-continue because they found out the doctor and nag-improve yung katawan niya. So kaya pa. Kasi hindi basta-basta gagawin ng yung chemotherapy, radiotherapy kung mababa ang immune system ng tao. Kaya there are cases, no, na minsan ang kinamamatay ng pasyente hindi ang cancer, kundi yung pagbagsak ng kanyang immune system. Sa naagapan niya.
Yeah. Do you agree with that, Richard? Did you feel like sometimes it wasn't a cancer? Sometimes it was
Doc Sani, totoo po yun. Ang ikinamamatay ng tao, yung bumagsak ang immune system. Kasi pag bumagsak ang immune system mo, wala na eh. Wala na talaga panlaban eh. Ang kalabasan nun, hindi ka man mamatay sa Nasopharyngeal Cancer, mamatay ka man namatay ka sa ibang klaseng sakit. Lalo na ngayon, may pandemic ngayon. Kaya kailangan may panlaban tayo, di ba? May panlaban tayo sa pataasin natin dapat ang immune system natin para po may panlaban tayo sa mga lalo na sa COVID-19 ngayong po.
Buti na lang you realized it. Na
Opo.
How important the immune system is.
Opo.
Yes.
Ibig sabihin hindi pa tayo ni Richard doon.
Exactly. So Richard can join us here and tell everyone about nasopharyngeal cancer because it's
bata.
Opo.
Yes. Okay, Richard, thank you so much for joining us. Do you have any last words or comments, takeaway for our audience?
Sa mga nanonood po, kailangan po pataasin po natin ang immune system natin lalo na po ngayon may pandemic. Yun po ang kailangan natin. Panlaban na rin ako nasa isip ko araw-araw panlaban ko sa COVID itong acai berry. Honestly, marami ako nakakakwentuhan. Pag ako may nakakwentuhan, tinatanong niya. Kasi exposed din ako, frontliner din po ako eh.
Frontliner.
Maski po nung maski po nung bago pa lang yung pandemic na yan, yung COVID. Frontliner po ako. Ang dami po nagsasabi sa akin. Sabi nila, ingat ka. Although, talaga nag-iingat din naman po ako. Ingat ka kasi survivor ka ng cancer, mababa ang immune system mo. Minsan na lang po, pabiro na lang po, sinasabi ko sa kanila. Sabi ko, kayang-kaya ng acai berry yan. Yun na lang po sinasabi ko. Pero honestly, talagang tiwala ako sa product eh. Kasi naranasan ko na yan eh. Nung ako'y may cancer at nag-survive ako ng cancer. Talagang po. Kaya may papayo ko po, basta pangalagaan po natin yung katawan natin. Uminom po tayo ng acai berry para tumaas po ang ating immune system para may panlaban po tayo sa araw-araw nating ginagawa. Tsaka sa mga ngayon na kumakalat.
Right.
Apo.
Okay. Thank you so much, Richard. Everyone, let's give him a big round of applause. Our frontliner over here.
Maraming salamat po.
Thank you. Thank you.
God bless po. Thank you po.
God bless. Stay safe. So that was Richard's story. I think it was very inspiring, no, Doc? He's a cancer survivor, and now he's out there fighting COVID.
Yes. Yeah, and that was 2014, and now it's 2006. When you have passed at least the 5 years, that's a good chance na hindi nababalik yan. You have the 5 years survival rate.
That's amazing. So, Doc, can you explain to us more about what acai berry or just a healthy diet in general, why do food supplements and boosting your immune system help address or perhaps prevent yung cancer ba?
Okay, I would like first to reiterate yung story ni Richard. No? As you can see, bagsak na yung immune system niya. But when he took actually organic acai berry, naramdaman niya. So, na-test yung doktor, nag-improve na yung immune system niya. Ay, pwede na. So it means, kasi there are some doctors na they just want their method ng ginagawa nila na procedure. No? Pero ako, on my experience of 20 years experience, iba ang action ng ethical drugs, kasama dyan chemotherapy, radiotherapy, at food supplements. Food supplements gives more cleansing and nourishing. And si Richard, ano siya ng cleansing particularly because when you're undergoing chemotherapy, marami siyang pinoproduce na free radicals or toxins in the blood, no? So we nash out siya ng organic acai berry. And then the nourishing part, dahil doon siya ganang kumain as a complication ng radiotherapy, no? Na wala yung appetite niya. Pero so hindi siya nakakakain. So yun ay na-supplement naman with the organic acai berry, no? Now, what are the components ng organic acai berry na nakatulong siya kanya? Anthocyanin. Anthocyanin also has the anti-cancer effect, no? But they found out anthocyanin is also good for bypass or angioplasty na patient, no? Another component ng organic acai berry is the vitamin C. Ang vitamin C ay mega dose ng treatment for cancer patients. In fact, here in the clinic, I give 30,000 to 40,000 milligrams of vitamin C as a dose, no? And third, very important also is to balance the immune stimulating effect. Secondary, dala ng omega-3, 6, 9, vitamins and minerals. So, in conclusion, nakatulong ang organic acai berry somehow to kill the cancer patient, the cancer cells, no? Second, to boost the immune system. But then when you're treating that patient, no, it's not enough that you kill the cancer cells. It's also a must na you should give something to boost the immune system, which organic acai berry have.
Right. Okay, and Doc, so acai berry and other antioxidants and other organic and natural things, they can really help us to address these problems of cancer, no? But what are the main treatments? So I think Richard mentioned radiation and chemotherapy, no? So what are the other ones, if there are any?
It can be surgery, but in the case of NPC or nasopharyngeal, usually radiotherapy or chemotherapy na treatment. Surgery, there are biologic drugs or palliative therapy and clinical trials. But you can go also on the natural side, no? Meaning, pwede ka, kung gusto mag-radiation therapy, chemotherapy, or whatever it is, we have also the natural method, no? Steam inhalation is very, very important. How do you do the steam inhalation, no? There are certain herbs, pagkatapos ilalagay mo siya sa merong steam lang na infused with that, at yun ang the form of treatment. Lahat ng phlegm or mucus ay makatutulong na ilabas at that will somehow melt the tumor that goes with it. Then I also give high dose vitamin C, which can help, and then natural antibiotics. No, you can get your natural antibiotics from the food, just like bee propolis. Yes, bee propolis, garlic, and then and bawang, sibuyas, at luya. Those are natural source ng antibiotic. Meaning, pag nagpaluto ka ng pagkain, panay vegetables, you put more of these spices. No? Bawang, sibuyas, luya, at garlic. Okay.
Buti na lang.
I mentioned about yes.
Yeah. Buti na lang Filipino food really uses these, no?
A lot.
Yes.
Most of Southeast Asian uses a lot of this, no? And then megadose of vitamin C, I mentioned all about that, no? And then antioxidants, no? You can get ordinarily antioxidants from, from fresh fruits and vegetables. But with organic acai berry, it's concentrated antioxidant. So it can help a
Right.
lot. Again, ang content ng free radicals are the antioxidants. The more mas madami tayong antioxidants, the better. Kasi kung mas marami tayong free radicals or toxins, mas kakasakit tayo. It should be the reverse. The more antioxidants and the lesser mailabas ang free radicals in the blood. So I think that's a mechanism how organic acai berry helps recharge.
Right. And so I think last year is while we don't have nasopharyngeal cancer, Doc, how do we prevent it?
Well, if you remember, I said earlier about the fumes, no? What are fumes? And he was they have selling barbecue, something like that, no? The fumes are also loaded with chemicals, and it's a form of gas. Kung palagi mo constantly na-i-inhale yun, that can also affect the cells inside your body. Fumes particularly, no, sinabi nga niya, and even in colon cancer, it's not only the meat, but rather chemical fumes also. Fumes is just like how they call the gas, something like that, no, which are filled with heavy metals, no. So it wasn't more, particularly on that kind of food, no. And then second is the food. He's so fond of processed food. Were you the one who studied in Vancouver?
Yes,
Lisa?
yes, I did.
I love the Black Forest ham from Vancouver. I eat a lot of those.
Oh yeah?
Oh yeah. Oh. But I cannot be eating it anymore. No, I also love ham. No, to be honest with you. But I eat it once in a while. So ibig sabihin, I also eat some processed food, but it's only once in a while. And when you eat that, as much as possible, meron kang pa-contra. Meaning, pag kumain ako, let's say, ng sardinas, mas maganda, maraming sa sibuyas that can help, no? Pag kumain akong barbecue, isasawsaw mo sa maraming suka, at bawang at sili. Mga tipong ganun, no? Or, kapag kumain ka, di ba, ng lechong Cebu lechon, sausaw, maraming bawang, sibuyas at luya, at suka. So, yun ang mga pang-kontra. So, you don't have to take it every day, that kind of method. Kasi, just like I also eat tocino, langganisa, pero when I eat those, maraming kamatis that will help to neutralize somehow. And of course, pag-take ng, at this very moment, pag-take ng mga supplement can help also.
Right. Okay, and Doc, while I still have you here, can we address some of our Q&As? Okay, so can coronavirus cause nasopharyngeal cancer?
No, the usual complication ng coronavirus, it could be heart attack, pulmonary pneumonia, or acute respiratory syndrome, no, distress. Those are the common complications.
Okay. Any relationship between EBV and oral sex? So, Doc, I think we discussed earlier whether it's an STD, and you said it's possible, no?
Yeah. Okay. I have to say that from the studies in America, they found out also that nasopharyngeal cancer is common among gay, no, because of oral sex.
Oh. Perhaps that's why it's more common among the males. Is that possible?
Yes. Because
I see.
walang kaberdehan, no? Because the male organs somehow they also have some virus or bacteria with it. So that's a fine also. Common also among gay.
Okay. Do we have any other Q&As? Okay, is it curable, yung nasopharyngeal cancer? And how long? Well, from Richard, I would like to believe it is.
Well, it depends actually. Lucky for Richard, because that's already stage 3 and 4. No? Pero kasi the earlier the diagnosis, it was found out much shorter ang ang process ng curing, no? Well, it depends actually. You know, I have seen one patient, no? I won't forget this patient. He has got nasopharyngeal cancer, and his nose is already gone. Totally denuded already. He came to me already, and it's already so foul smelling. I can't do it anymore. I cannot treat him anymore. There's nothing I can do, no? Pero why? I asked him, why did you come only now? On the first place, he's got no money, no? He's got no money. And the second place, he's afraid that it's really cancer. And still he's going, it's already in stage. You cannot do anything about it. No? So, a lesson for all of us, no? Sometimes kahit wala tayong pera, ibig sabihin, meron naman tutulong, magpatingin tayo sa mga doktor, particularly kung sabihin natin mga bukol-bukol na, para makita mo na is it benign or malignant. That's the first thing you have to do. No? I have to tell you that kasi October is Breast Cancer Awareness Month. And Philippines has the top number one killer or number one in Asia who has the most of breast cancer. Again, alam mo, related also sa food natin. Maybe we have sometime later we can address that. No? Breast cancer is also, it's a must kasi that's the number one top killer disease for the female right now.
Right. Okay. This one, so many processed foods pa naman in the market. I hope we can find healthy alternatives to preserve and treat foods. Well, Alex, there are many healthy alternatives to preserve and treat foods, actually. And you'll find lots of brands out there are getting into the organic and natural preservations and processing of food. Yun lang is it's not as common as it is the processed foods. So us as consumers, we have to be more conscious and aware, do our research, right, Doc?
Yes. And the thing about it now, if you're going to find some alternatives, sometimes they are more expensive as compared to ordinary which you can find in the market. No? Pero ako, if you want to be healthy, 80% of your food should be based more on vegetables and fruit, and only 20% about the meat products. That's the most ideal on a daily basis. No? Mas marami talaga tayong vegetable.
Right. And if you go to the market and you buy fruits and vegetables, you'll find it's not really that expensive compared sa mga processed foods like bacon and mas mahal naman ang bacon, Doc?
Yeah, bacon. But I love it.
Me too. Me too, but sparingly na lang. Okay, one last question. Doc Sunny, does acai berries kill cancer cells?
Okay. It can help, particularly I mentioned about a component on this. No? You research on this. Acai berry contains the anthocyanin, which has the anti-cancer effect. And then this anthocyanin also, ideally for mga pasyente for bypass of angioplasty, because it has the function of vasodilation. In fact, nung una ginagamit ko lang siya pang mga pasyente for bypass angioplasty, no? Because of the vasodilation effect, pinapaluwag yung circulation. And then I found it's very effective, particularly for cancer patients. And I have so many cancer patients, Lisa. And would you believe, pag nakita mo sila mukhang walang cancer? Why? Kasi they're glowing. They're glowing, no? Ang cancer kasi has a very good effect on oxygenation. Ang gaganda ng kutis nila. You won't mistake them na merong cancer because they're glowing. Because I give them how much? 1/4 cup 2 to 3 times a day. Why? Because of the antioxidant effect and the nourishing. So, sa nourishing part, it can help particularly because of the high content ng pinapagiging niya para sa oxygenation for the whole body. And oxygen is one form of treatment for cancer patients.
Oh, okay. So that's good to note. We're running out of time now. Thank you, Doc, for explaining to us here and answering our questions. Do you have any last words about nasopharyngeal cancer?
Not only for nasopharyngeal cancer, but rather in general, our condition like coronavirus, similar to nasopharyngeal cancer as coronavirus. As Richard has said before, napaka-importante to boost your immune system. So how will you boost your immune system naturally? You should have enough sleep, enough rest, and then exercise. And of course, diet, you should also be monitored. And as well, it's about time we should take food supplement like organic acai berry. I also use that as particularly more for my patient. And it's versatile. Mula baby na sipulin, pwede mong i-feed yan until matatandang hindi makadumi, makatulog, o walang gana kumain, you can feed that. No? So it's very good, versatile, the whole family can take.
Yes. All right. Thank you, Doc. Thank you for your last words. Thank you for participating with us here today. We hope to see you in the next Wellness Wednesdays to come. But for now, take care. Stay safe.
You too. Yes, good night.
Thank you. Good night. Okay, thank you sa lahat ng mga viewers for joining in, and especially those who joined into our Facebook game. Now we're going to announce the winners. So here we have Abigail Sabanal. So it was last year when it happened that you tuned into TV5, Radio 5 with Cheryl Cosim. Oh, Cheryl's been a long-time loyal consumer of ours. In Perfect Morning, you were searching for a healthy remedy for your kidney problems, and then see Miss Kathy and see Miss Cheryl discuss healthy ways to care for your kidneys. And that was your first time to hear about the product and its vital role in wellness and health. Thank you, Abigail, for your submission. I hope that your kidneys are doing all right. It's very important to take care of our kidneys while we have two. We don't really want to abuse both of them, no? Especially if you're taking a lot of salt-cured foods right now. Okay, so Judy Tan, the timing couldn't be more perfect because I was really looking into taking supplements that can help me with my health and wellness journey. My uncle recommended organic acai when the time he knew that you have health problems 3 years ago. So I now am proudly taking organic acai for almost 3 years. It's the best healthy lifestyle because you can get so much more than you expected with this product. Great to hear. It helps me to relieve stress because the acai berry can help regulate stress levels and repair the body. It helps me to have a better sleep. The vitamin B and other nutrients in acai reduce stress and brain cell communication by assisting with the production of neurotransmitters like dopamine and serotonin. That is based on my research. So now I feel the changes and I already achieved a healthier body. Thank you so much, Organic Acai, for your trustworthy products. Thank you, Judy Tan, for your insight here. I love how you did so much research because nowadays, everything is online. We have the access to resources. It's important for us to stay informed, for example, with this Wellness Wednesday about our health. Thank you, Judy. Okay, Rejoice Puerto. So, I'm sorry, I'm not the most fluent in Tagalog. So, okay, from work and then the gaming area. Sorry, I'm just gonna summarize this in my head. I'm gonna read this first and then I'm gonna get back to you. Ngayon, 1.5 years na, you've been working as a brand ambassador for the product. Oh, wonderful. Honestly, you've been exposed to a lot of free radicals, especially because of the field work, and exposed to a lot of what we call carcinogens, such as pollution, viral infections, secondhand smoke. So and now you have acai capsules for your health. Oh, and then you're also giving it to your kids. So thank you, Rejoice. I'm so sorry. I'm not the best in reading this, but I'm trying to work better on my Tagalog. Kasi I'm Bisaya, I'm Cebuana, and I lived most of my life, studying in Canada. But to summarize Rejoice's story over here, so Rejoice used to work in a casino in gaming, and she was exposed to a lot of carcinogens, and now as a brand ambassador, she's able to take organic acai or capsules and give it to her 3 kids. So thank you, Rejoice. I will do better on reading your Tagalog stories, and I hope that you enjoy the gift pack. Okay, so Jens Galvez. So without organic acai, we've lost our mom. 10 years now to take your mom, and actually the doctor's prediction is 5 years na lang. But luckily, she was still alive and kicking. Pulmonary hypertension ang sakit niya. 15 years. Oh. And then after that, you had the products. So thank you, Jens, for sharing your personal and emotional story. We are glad that you feel that Organic has helped you spend more time with your mom despite the doctor's predictions. And we're hoping that, it does have that emotional touch and connection for all the other families. And so for Luz Sarmiento, so 2015 Feb, you were diagnosed with aortic valve stenosis, needing open heart surgery. Oh my gosh, intense. And then the second opinion said mechanical problem. Oh, okay. And nag-start na inom ka acai berry, and then you already saw improvements after 10 months. Amazing. And then so you decided to undergo open heart surgery. Okay. December 10 ako nag-surgery, 6 a.m. dinala na ako sa operating room, 8 a.m. nag-start opera, 12 noon finish, 4 p.m. ako nagising ako, 5 days lang. Continue pa rin hanggang ngayon, pag inom ko acai berry, mula noon hanggang ngayon, pansin, okay. Sa ngayon, ang family ko na inom na rin, pati sister ko, diabetic. Okay, thank you, Luz, for sharing your story about dealing with heart aortic valve stenosis. I think it was a very brave thing for you to share with this open heart surgery, and I'm glad that we were able to help you on your journey. And I would just like to note with the story also that you had both doctors' opinion and a healthier lifestyle. So honestly, those two together, listen, you're not giving your illness a fighting chance. No, you're really taking it against them. And same with your sister who had diabetes. So thank you for our winners, Judy Tan, Abigail Sabanal, Luz Sarmiento, Rejoice Puerto, and Jen Galvez. We hope that you enjoy your Organic gift pack. Thank you so much for sharing. And then so moving forward, those were our winners. Now for others who did not participate in our Facebook game, we do have a gift pack for you to offer to your family and friends during this holiday season. Now, what we have over here is yung Organic Acai Super Pack for 2.5, which is the price of one bottle. You can get one bottle plus 5 sachets ng acai coffee and acai choco. And this is exclusively available at Watson's. Now, moving forward, we'd like to also invite you to be one of our resellers here in Olani. So if you don't think you can purchase this gift pack over here, you don't think you can purchase this gift pack, but you still want to share the gift of health with your family and friends, then we invite you to be one of our resellers. Share the health, spread the wealth, earn for yourself as well, especially during this economic downturn that is a COVID-19 pandemic. So for those who are just tuning in, thank you. It's the end of our Wellness Wednesday right now, but I hope you can rewatch this or tune into our next Wellness Wednesday. Thank you so much for those who commented, shared your stories, participated, shared this Wellness Wednesday. And we'd like to thank also our guests, see Doc Sunny Valoria and see Richard Diaz. Thank you and have a happy Wednesday.
Wellness Wednesdays with Organic. We care because you matter.